Hi, my name is Talia Hoffman. My presentation is called All Vaxxed Up or All Natural. I did have a video in which I had an audience, but the video got messed up, so I'm just redoing this. Obviously without an audience, unless you count my dogs. So for the first portion of my life, I had no idea what we in the West view as regular medicine is actually called allopathic medicine. Why did I, like many others, have no idea of this term? Well, I believe it is due to the fact that most people do not know that there are alternatives to the standardized medicine practiced here in the West. What are the other options? Other options include homeopathic and naturopathic medical treatments. There are colleges here in the West that allow for doctors to specifically pursue that kind of career. I, for one, plan on going to one of those colleges to obtain my ND, my naturopathic degree, or my naturopathic doctorate degree. What would possess someone to step outside of the bounds of the standard allopathic medical schools and treatments? For me, the answer is vaccines. Now, I know many of you probably heard this and thought, oh no, she's a crazy hippie. And maybe I am a hippie, but I'm definitely not crazy. Before you jump to any conclusions, just listen to my research that I have come across in coming to my decision. A few nights ago, I decided to watch the documentaries Vaxxed and Vaxxed 2. I was cautious of vaccines before watching these due to hearing and seeing things here and there about how vaccines are not what they used to be, and it is evident that they are harming us. After seeing countless stories of families dealing with vaccine injuries, death due to vaccines, and yes, even autism post-vaccines, I knew I needed to do a little bit more research and look into this more. I decided to start by looking up something I had seen in the documentaries. Are vaccines tested against a saline placebo? Surprisingly, the answer is no. According to an article written by the WHO, the World Health Organization, however, controversy surrounds the appropriate design of vaccine trials and, in particular, the use of unvaccinated controls with or without placebo when the efficacious vaccine already exists. In other words, it is considered unethical to test a new vaccine alongside a saline placebo if a vaccine for said disease already exists. This is extremely concerning. According to the NIH, the reason for placebo usage is so that researchers can be certain that the treatment they have come up with works and is safe or unsafe. Saline only hydrates the body. It would not cure disease or prevent it. One group of patients is given the placebo and one is given the drug so that the results can be properly measured. Why is it ethical in this situation but not for vaccines? Unless it is an emergency, all participants and their legal caregivers must give informed consent to the clinical trials they participate in. This is according to informed consent laws. As we can see, all participants, aside from an emergency, are willing participants. If the participants are told they may receive a placebo or the drug being tested, just as every other drug trial is conducted, why is it only unethical here? This is especially concerning because most vaccines are given to babies. The CDC has a chart which shows that babies can start being vaccinated at birth. From birth to 6 years old is when we are supposed to receive the bulk of our vaccines. Why would we put the most vulnerable of us in a position to be injected with drugs that we do not truly know the side effects of due to improper clinical trials? Many people and even doctors scoff at the idea that vaccine injury and death are a real possibility. A multitude of parents have shared how their children have dealt with lifelong conditions such as autism after the MMR vaccine. One study shows this to be true, usually but not always in conjunction with antibiotics. According to another article, virus-induced autoimmunity may play a role in autism. It is also known that aluminum and fluoride are both neurotoxins, which cause long-term effects that resemble autism spectrum disorder. Both of these chemicals are found in many vaccines, including Hep A, Hep B, the flu shot, MMR, and more. That is according to CHOP, the Children's Hospital of Philadelphia. From something as complex as the MMR vaccine to something as innocent as the yearly flu shot, we can see many damaging effects. We are also taught that herd immunity works and that there are natural ways to fight off viruses. How to cure cites that zinc stops the influenza virus from multiplying. There are far fewer side effects and far less severe ones at that for zinc and herd immunity than there are to take vaccines that are incorrectly tested and shown to have extremely strong correlation to illness, injury, and death. This is why I am choosing to go down a naturopathic degree path for my future. I would like to say one last thing before I go. If I have not convinced you yet that vaccines are clearly a poor path to take, I think I can convince you with my own personal experience. When I was 13, I received the first Gardasil shot, the HPV vaccine, in a series of 3, which I did not complete. This one shot caused my entire left arm to go numb and limp. I was unable to use it for the next few days. I also became very ill and had a fever so high that I started seizing. I am a victim of vaccine injury. And though my case is anecdotal, I am one in a sea of many who have dealt with similar and worse side effects. I am thankful to my mother for not making me continue this series. So I ask you, would you rather be all vaxxed up or all natural?